Hello and welcome to today's show. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Today we're going to talk about radiation oncology and the treatment that's involved with that. I'm joined today by Lisa Feldson, who's a nurse over at the Western Baptist Hospital's Radiation Center, and she's going to share a little bit of information with us today about what entails radiation therapy and hopefully answer some questions people may have. Thanks for joining me today.
Thank you.
And Lisa, if you wouldn't mind just kind of taking a few minutes and telling them exactly what you do at the hospital and how long you've been there.
Well, I've been at the hospital 27 years as an RN, and I've spent the last 13 in the radiation department. What my job entails is we do workup charts, and we talk to the patients, and we do education for patients. We answer questions, we do assessments, we schedule them for tests at the doctor's order. We answer lots and lots of questions, and we participate in programs that help educate patients.
Good. Okay. Well, first of all, let's just kind of start out with the basic information. When someone's diagnosed with cancer, obviously there's lots of different options for them for treatment, surgery, chemotherapy, and then obviously radiation as well. So let's just talk about the basics. What is radiation treatment, and what would a person encounter when they're going through that?
Radiation is one of the treatment modalities that we use for cancer patients, and what the radiation does is it kills some cells outright by the radiation effect, and then other cells, it changes them so that they're not able to reproduce themselves, and so as that cell dies, it's not replaced, and that's how the radiation works. We do use it in many types of cancer. We use it for lung cancer, we use it for breast cancer, we use it for cancer of the head and neck, we use it for cancer of the esophagus, cancer of some parts of the colon and rectum, and we do it for the prostate. And then we have some other types of cancers that we treat, but those are the big ones that we treat the most. The treatments themselves range anywhere from 10 to 14 treatments for a short course, up to about 40 or so for a more definitive course, which means that we're trying to cure somebody. We use radiation to treat pain. We use radiation to treat the cancer itself, and to try to put off a cancer effect of some sort, whether it's pushing on something causing pain or pushing on something causing them hard for them to breathe or something like that. So there's lots of reasons that we do that.
Okay. Is there a specific reason on why some types of cancer, say breast cancer, some women have radiation, some don't? Is there a specific reason on why that occurs?
They did a study several years ago, and in that study they determined that if a woman has lumpectomy and she has radiation to follow that is equal to treating them with a mastectomy. So they use breast conservation surgery, and so do a lumpectomy instead of a mastectomy, and then we radiate them behind that, and then that brings up their rate of cure to equal a mastectomy.
Okay. Is that the same with other types of cancer as well?
It can be in some of them, and some of them they have a choice. They can have chemo and radiation, or they can just have radiation. And the way that is combined or sequenced depends on the patient. Some patients just can't tolerate some combinations of treatment, but if you do it a certain way, then they can tolerate that better.
Okay. Okay. There's two different types of radiation, external and internal, and you mentioned those briefly, but can you kind of explain the difference between those two?
Sure. External is where we lay you on a machine, and the machine puts radiation into you so that to treat your cancer. The internal radiation, there's several different forms. We have IV form that we can use, and we use that for bone mets. And that's a metastasis from another cancer that goes to your bone, and it's for people that have lots of spots, and we use the quadramet or samarium as an injection to go to all those spots to treat those areas. We also have a radioactive iodine that we use for thyroid cancer, which comes in a tablet form, and they take that. And then the other type that we have that's internal is like for implants, and that is it's a source that is placed into a device into a cavity, and it can be a natural cavity for like gynecological cancers, or it can be a man-made cavity in the event where we've made a hole and put a tube through and run the source through that way.
Okay. So there's lots of different types of radiation, but obviously technology's come a long ways, and each of those can be more beneficial perhaps in certain situations. So let's talk a little bit then, what really determines the course that they take when they go in for radiation treatment? How is their case presented by the doctor, and how do they plan their course of treatment?
It really depends on the diagnosis. Our facility is accredited by the American College of Radiology, which is the way that we're accredited for our radiation therapy. The hospital also has other departments that are ACR accredited, and we're accredited through the American College of Surgeons. And there have been studies done, and there are NCCN guidelines that help guide the way that we treat. So if it's a breast, what you expect to treat is this way, and if it's a lung, this is the way that we expect to treat. And so we follow those guidelines that have been proven by evidence-based practice there.
Okay, good. That's good to know. Sometimes you wonder, how a doctor really comes up with that, so that's great to be able to know that. Obviously, the goal and benefits of radiation, talked a little bit about it, but what's the ultimate goal, obviously, from radiation treatment?
Well, we actually have different goals for different patients. In some patients, we have an expectation that we're going to cure them, and we treat them aggressively, and the goal is for them to walk away from this and be okay in 5 years. Right. We have other people that the goal is to give them the best quality of life that we can at this period of time, to control the cancer as much as we can at this spot, and then to hold on and see what we need to do after that.
Okay, perfect. And are there any risks associated with radiation therapy?
Well, there's risk with everything. If you take an aspirin, it makes your blood a little thinner. So if you take radiation, there is a risk. Most people have some skin reaction to it. Most people have some tiredness from it or fatigue. And then you can have other side effects depending on what part of the body that we've treated. And then there's always a long-term risk in 15 to 20 years that you have an increased chance of a cancer in another site from the radiation itself. So, I mean, there is some potential risk for that.
But again, you outweigh the
We try to outweigh the benefits against the bad things and the risk, and try to balance that out to make the best choice for the patient at this time.
Perfect. You talked briefly then that some of the treatments can be, you said 10 to 13 or longer. Is that a treatment that they receive every day, or is it once a week, or how is that designed?
Our treatments are daily, 5 days a week, Monday through Friday. We do give treatments occasionally on weekends depending on the case. And we do miss holidays, which is unusual. A lot of people don't miss holidays, but we do miss holidays, and sometimes that can be very beneficial to a patient that's about midway through or a little bit past that in their treatment. It gives them a little extra break so that their sore throat gets a little bit better, or their tiredness might get a little bit better. But it is Monday through Friday, 5 days a week, and there is a rationale behind that. The idea is that the normal cells need time to recuperate from the radiation, because the side effects of the radiation come from the normal cells' response to the radiation. The cancer cells don't respond that way, but the normal cells have to have time to recover. Okay.
And if a patient's receiving treatment and they experience some side effects, whether it's the tiredness or the pain, what education can you give them to help them deal with those side effects?
Well, for fatigue, we suggest that they try to take it easy, don't overexert themselves. If they feel like they need to take a nap, we suggest that they follow that inclination and take a nap. We suggest that they eat well as they can, a high-protein diet, and that they snack so that it's easier for them to eat. Some of them have trouble eating because it's just too much to eat at one time. So if they snack through the day. And as far as like for skin, we have prescriptions that we give them as their skin gets tender or sore to try to help speed that healing along a little bit so that it's not so bad for them.
Okay. And maybe some people that have these side effects, how long might they last after they have treatment?
That's real individual. We have some people who have side effects kind of from the beginning of treatment, and then they're kind of easing up by the time the treatment's over. We have others that don't start until about midway, and then we have some that wait until the end of treatment and then they have their side effects. So everybody does a little bit different, but the majority do have side effects of some sort to the treatment.
Okay. So people shouldn't be really surprised if them or a family member kind of complain of that, and being able to help deal with those. What is some of the tips that you give a patient while they're going through radiation treatment to be able to take care of themselves?
Well, we do suggest that they take good care of themselves, share their workload. If they're a big worker at home, that they share that workload, let people do for them. We suggest that they take naps and rest, and we suggest that they eat well, and we suggest that they just try to do the best that they can with what they've got to work with, and it really depends on the type treatment. Some of the patients have less of these side effects than other patients. So some of them, we have patients who come and work every day, they're taking their treatments, and then we have other patients who don't work while they're taking treatments. So it just depends on the patient and where they were before they started.
Okay. You've talked a lot about nutrition and being able to eat well. Are there any resources that you provide for these patients to maybe help with some of that nutrition, whether it's dietary counseling or anything like that while they're there?
We do. We have a dietitian who comes in and talks to them, especially if they have weight loss. We have a dietitian. We recommend supplemental feedings with various nutritional products that you can buy over the counter. We have several of those that we offer people. If it gets bad enough, we do have contacts within the GI community so that we can get a tube put in to help them. If it's just mechanically, it's just too hard for them to eat, that we can bypass some of that to make it easier for them to get nourishment.
Right. I know personally my father-in-law ended up having to do that. He had radiation to the throat, and obviously he complained a lot of metallic taste and things like that, but he actually had a feeding tube in for like a year and a half, and that's what you just poured it in the tube, and but it definitely kept his strength up while he was doing that. Going back to the actual radiation treatment and talking about that internal radiation, if you have to put the implant inside, how long would that stay inside?
Well, we actually have a couple of methods for that. We have one that's a high dose rate brachytherapy, and it can be about 10 minutes for the treatment. And the device may be in all the time, but the treatment source would be in for around 10 minutes or so of treatment. We have one of those that we do for breasts, and it's we do it twice a day, and it's for 5 days. So in 10 treatments, that treatment is done. Now, this particular treatment is designed for a certain set of patients. They have to meet certain criteria for that type. We also have a low dose rate, which is a more conventional type implant, and you see that a lot in gynecological malignancies, and in those cases, they stay in anywhere from 24 to 48 hours at a time, and that is the source that's in.
Okay.
So those people are on bed rest, and they're in the hospital, and it's a procedure.
So they're actually admitted into the hospital on a hospital floor then for that treatment?
They are.
Okay. All right. When we talk about if a person's newly diagnosed and perhaps they have to begin receiving radiation treatment, what would they expect whenever they first showed up at the radiation therapy center?
Well, at our facility, they talk to a nurse first, and we try to get their history together as much as possible, have their records together, and have all that ready for our nurse practitioner who speaks to them and does a physical exam and works on the dictation and assists the physician in that whatever he needs. And then we have our physician sees them and does the consult and tells them his opinion and gives them the options, talks about risk and benefit, and it lets them ask questions and answers questions until everybody's satisfied.
Okay. And so then when do they actually begin their radiation treatment? Would they begin it at that first visit, or?
There are some who do. If they're coming for pain or shortness of breathing or something like that, some of those can start that day, and we do have a way to do that. If it is somebody like a prostate cancer or whatever, a lot of those require a time to set them up in a simulator, which is an x-ray machine where we can take pictures and do marks, and then we do a CAT scan. And our CAT scan is not diagnostic. Our CAT scan is designed to scan their images into our computer so that we can do a treatment plan. And depending on how long it takes for them to do that planning, then we can get them started after that, and it can be around a week.
Okay.
Sometimes for us to get those started.
Are all those tests ran right there in the center, or do they have to go to?
They're done right here with us.
Okay. And then who would actually end up running the radiation? Let's talk a little bit about that because it's a neat process.
Okay. We have therapists who do that. They're all they've all been to school and they're all trained. All but one are registered through the state of Kentucky as a therapist. They're all trained in radiology, and then they're trained as a therapist too. And they actually do the machine, and as far as running the treatment, they do that part after the doctor has written the plan and designed it, and our physics department has worked on the plan.
Okay. And then how long, I know that it varies for different radiation treatments, but how long might a person actually have to lay if they're going to receive that radiation treatment?
Around 10 minutes.
Okay.
And it can be shorter than that, but around 10 minutes.
Okay, so they're not laying there all day receiving this treatment. Some people may wonder about that. What do you think patients seem to be concerned about the most the first time you ever sit down with a patient to talk to them?
If they're not anxious about the diagnosis and what that could mean to them, then they're anxious about the treatment and will it hurt? What kind of side effects will I have? Will I get through this?
Right.
Yeah.
And what do you see as support for them from family members that come in as well? What questions are they asking you, or are they kind of the backbone for that patient while they're there?
A lot of them have the same question the patient does. Some of them are not as verbal as the patient, and then some of them are more verbal than the patient. Sometimes the patient is afraid to ask, and so sometimes family members come with them to ask to get the information out into the air, I think.
Right. Yeah, I think sometimes as a person that's diagnosed with cancer, sometimes they just hear the word cancer. But obviously sometimes a family member can just hear the word cancer and not hear the other things that the doctor or the nurses really have to tell them about that education part. So
I think you're right there.
So it's important for definitely having a good team for treatment and being able to talk about things openly. So I'm sure you have a lot of time where you just been talking really more than anything else for a while. What do you do if a person, perhaps you say that they have to come every day for maybe a week or so or longer? What if they have problems with transportation to and from?
Well, we have contacts. Some insurance companies, help provide for transportation. And if a person has that benefit, then we work with that. And if they don't, then there's some vans that we can use that we put them in contact with so that they can ride that van. American Cancer is available to help us try to find transportation for some of these patients.
Good, good. And they have the transportation grant there at the hospital too that you all can use for people that need appointments there. What if a person has, they have insurance, or if they don't have insurance but they have financial concerns? What kind of availability do you have there at the hospital for them to find help?
We go through our financial counselors and our social work team, and they help us with those concerns.
Okay.
And we do that. There's a lot of people out there that have financial concerns.
Right.
There really are.
And do they actually come over there to the center, or do the patients get to go to them?
Most of the time they do come to our center to help us because some of our patients just don't have the capacity to get there.
Right. It's kind of hard on them to walk around that much. You did say that some people can sustain working while they're going through treatment and others can't. Is there a set guideline that you kind of give people to help decide whether they can or can't continue working?
It's real individual. Some people they have the mindset that this is going to be okay and that they're going to get through this, and they don't have the side effects that others do. But in some cases, some of the cancers, we know along with that treatment what side effects are there, and so we do work with those patients and give them advice as to what we think. And then we work with them and work with their employer and try to get that fixed for them.
Good, good. So people don't really have to worry about that then, that they do have help. You talked a little bit too about some skin sensitivity to the radiation. Let's talk a little bit more about that and what exactly that really entails, what a person's going to feel, and then what you can do to help with that.
Okay, most patients have radiation depending on the location, but in breast areas and areas where there's skin folds. Most people do have some skin reaction there. Their skin can turn pink if they're fair complected, or red. It can turn browner if they're inclined to tan out in the sun.
Okay.
And that's called hyperpigmentation. If that occurs, then they tend to stay a little bit browner than they were before they started. They also have some itching. That is very common. Pruritus is the word we use, but anyway, they have itching in that area, and we have medicines for that, and we have advice for that. And then if in areas where there are skin folds or where skin rubs each other, those areas are prone to breakdown, and that's not uncommon. And what we have medicines that we do for that. We use cornstarch at the beginning to try to keep it dry, and then we have medicines, steroid creams and stuff that we use after that. And we can use Silvadene cream if we need to, and people have seen that for burns, like from an iron or something like that. And we do use whatever it takes to get them through that, to make
Okay.
it easier for them.
When you say that the skin breaks down, do you mean that it opens up into a wound?
It can open, yes, it can.
Okay.
It can blister, and it can open, and then the skin can come off, and then they have an open area. So yes, ma'am, it does.
Okay. So then would you have to treat it for a open wound then?
We treat it whatever it requires at the time. We start out with the steroid creams, and then we can progress on to the Silvadene and stuff if we need
If
to.
needed. Okay. Now, what about for like men? I noticed with my father-in-law, whenever he received radiation, then he had trouble with hair growing back on his face. Is that very common?
It is very common as you get up around a certain level of radiation dose, and it's around 6,000 or so. Hair tends not to come back, or if it does, it's sparse.
Okay.
We do see that in people that have radiation to the head for tumors. We see it for people that have head and neck radiation in this area, particularly for men that shave. We do notice that.
Okay. Is it the same with their arms and their legs as well?
It would be if they got that much. Yes.
Okay. All right. What about activity when they're doing radiation? You've told them to get a lot of rest, but do they need to remain some sort of activity as well for their physical well-being?
There's actually been a study done for breast cancer patients that if they get out and walk and exercise, that they do better with their treatments. They have a better outlook, a mental outlook, and along with a better mental outlook, a lot of times you have a better physical outcome.
True.
So there has been a study that I read in the Journal of Oncology Nursing that described that, and they really believe that some exercise and stuff, getting out and walking, is a very good choice.
Okay, so just
And
as much
not
as
to
they
overdo
can,
themselves,
right.
but to get out and do that.
So maybe just as much as they can, even if it's just walking to the mailbox, right? Okay. So we talked about fatigue, obviously, and taking naps, but is there anything else that they can do to help with that fatigue besides just taking breaks throughout the day?
Really and truly, just taking care of themselves, eating well, getting the sleep that they require, whatever that is, napping, sharing the workload. Those are really the best things that they can do for that.
Okay. And so they shouldn't feel bad if they're taking 3 or 4 naps a day, and
No, they shouldn't.
family members will be very supportive of that, I'm sure. After radiation treatment is complete, who does the radiation oncologist then turn their medical care over to?
They usually go back to their medical oncologist that they
Okay.
belong to because they need somebody to care for them for 5 years. Now, not all of our patients are turned over so that they only go to the medical oncologist. Some of them, they do stay with us for about 5 years in follow-up, depending on the doctor's discretion, but some of them do stay as long as 5 years with us.
And how often do they have to come back right after treatment?
Most of them come back in either 6 weeks to 3 months, and then they can come every 3 months, and then it goes to every 4 months, and it goes to every 6 months, and up to a year until we wean them off.
So I'm sure they become extremely close to you all.
We do get close to a lot of them, yes, ma'am.
Yeah, I'm sure. Is there other treatment that may be needed after radiation then to make sure that the radiation was successful, or to decide, can they have radiation treatment again? What are the guidelines with that?
We have patients who are under surveillance, meaning that they come back every so often for CAT scans, MRIs, PET scans, blood tests for some cancers. Prostate cancers, we check for PSAs, and the breast cancers are breast cancer markers that the oncologists use. But we frequently do a lot of tests that way over time. And like the gynecologic cancers, they have to have pap smears and stuff to make sure that things are okay with them. And over time, we hope to progress them out to where that they don't have to come back and see us. Unfortunately, some of them do come back to see us for various reasons, and that question was asked, can you have more radiation? It really depends on how much radiation you had to the site. If it's the same site, if it's a different site, then obviously yes, they could have more. But even if it's the same site, depending on how much they had, they may can have more to that area if they need it.
But sometimes they can't then.
Sometimes they can't.
Okay. All right. So what is the one thing that you would want people to take away from today's show about radiation therapy?
I think my dad had radiation when he was 49, and he's 73, almost 73. And I think it would be that radiation can be a big help to a lot of people. I wish that people wouldn't automatically think that it's a terrible process, because it really is a lot different than it used to be. We use IMRT now, which is an intensity modulated radiation. And what that does is it enables us to treat a smaller area so that there's less side effects. And so there's a lot of people who know people that took radiation a long time ago, and they have an opinion. And sometimes it's just not the same way as it used to be. That's not to say that we don't have side effects. We do, but there's a lot of things that are just not the way they used to be.
Right. So radiation's definitely come a long way, just like every other medical technology. Really, we've come so far from even 20 years ago. And what advice would you give a patient maybe coming in next week for their first consult and their first visit?
I think it's always wise to sit down and try to write down your questions. Invariably, even myself, if I go to the doctor, I'll get out and I'll go, man, I wish I had asked one more thing. So if you know that you're coming, write down your questions. No one's intimidated by a list of questions. That just means that you've put some thought into it before you got there. And, you know, our idea at our department is this is bad enough for you to go through. And so we try to inject a little levity, and we try to be real personable to people and treat them on an individual basis so that when they leave, they feel like that we have cared for them.
That's good. And what about the caregivers that are out there? What advice would you give them obviously your father went through it, so you've lived that course. And so what advice would you give them?
I think they're the same way. I think they need to write down their questions.
That's a good point.
I think that's a really good thing for them to do, because I think the part about medicine stuff that bothers people the most is their feeling of lack of control. And if you come in armed with questions and you leave with an armload of answers, I think that's the best chance that you have to feel some control. And as you feel more control, then you feel more confident, and then you feel more relief that that there's an end to this and you're going to get through it.
And as a nurse, I'm sure that you can give your own personal testament to the fact that you take great attention into being able to sit down with these patients and answer every one of their concerns before that treatment begins.
We do. We try to answer all of them, and our clinic is always there. So I mean, like if they see us on Tuesday and they have questions and we answer them, if they have questions on Wednesday, we're still there.
Good.
So that's a little bit different than some places, but we're always there. So there's somebody there that can answer that question.
Good. Definitely create a holistic approach to the treatment and for all aspects of what they're going through.
We try to.
Great. Thank you so much for joining us today, Lisa. And I certainly learned a lot, and I hope that other viewers at home did as well. We hope that you enjoyed today's show. And if you have any questions about today's show, feel free to call the Kentucky Cancer Program at 442-1310. We look forward to the next show, and we hope that you join us.